Hi, this is John with Diabetes You Can Win. I'll be going over some exercises included in the at-home chair exercise program with you today. This particular exercise is a leg press variation. I will demonstrate this exercise along with some variations and modifications to it as well. This exercise targets the muscles in the legs and the hips, including the quads on the front of the thigh and the glutes on the back side of the hip. Again, the ACSM recommends 2 strength training sessions a week with at least one set of 12 to 15 reps per major muscle group, and these workouts can be included as part of 150-minute recommendations of moderate intensity physical activity. Please ensure that you're clear to participate in any physical exercise program before starting. Consult with a medical professional when doubt arises, and please pay attention to severe symptoms such as discomfort, pain, dizziness, shortness of breath, and immediately discontinue the exercise program and consult with a medical professional if these should arise. For the leg press exercise, you can begin by grabbing the handles with both hands, looping the band securely around the foot to prevent it from rolling off the top of the foot, and then clasp the handles close to the chest and keep them in the same position throughout the exercise. Once you've maintained this position with the bands, you will then bend the knee so that the knee comes towards the chest. And once you reach the point where you can no longer either maintain your balance or the knee no longer can move anywhere closer to the chest, you'll then slowly extend the leg till it's out in front of you. You can go up to maximal extension or to what's comfortable, again, making sure to stop at pain and not go through. And then you will slowly return back to that same position and paying attention to make sure that you're not rocking either forwards or backwards, side to side, twisting, trying to maintain stillness in all the body except the working leg. Also maintain the non-working leg, foot planted flat on the ground in order to prevent loss of balance during the exercise. All right, so then if you're wanting to increase the resistance and make it a little more challenging, from that normal starting position with the hands on the handles, if you go ahead and just put your hands on the band and then loop that around the foot, then you're going to go ahead and pull the band up to the chest, and then you can rinse and repeat the same procedure. This should make it a little more challenging, make the band a little shorter, which is just going to make you have to work a little bit harder to increase, to maintain the same movement that you were doing before. And you can continue on. The two things you want to pay attention to is you can continue to wrap the band around your hand and just keep shortening it in order to increase the weight of the band. You just want to make sure, as you can see here, you can just start losing, getting to the end of the band, and you just want to make sure you don't break your band. So be careful not to put too much tension through the leg or through the band. If you're getting to the point, we have some other exercises here that are going to be a little more challenging that you can move into. And then you also just want to be careful that you're not actively crushing your hands or causing any type of damage to the skin on the hands by wrapping that band around the hand. And so if you find the band exercises, particularly for these leg press exercises, if these are too easy for you or you're very more capable of moving your own body weight in terms of like standing up on your own, you can start moving into some body weight squat variations. So this first one is just going to be using any type of brace. This could be a countertop, a table as seen here, or really anything that's just going to be able to support your body weight that you're going to be able to kind of assist yourself with. So you're just going to put your hands and you're going to use your arms to press on the table and then just come up to a standing position and return back. This is also not only for stability but also just aid in the actual strength of the motion. And then hopefully once you're able to get to the point, we can take the hands off and you can do a body weight, just essentially standing up from the chair, and you can either way help moving into different positions. And then you can also increase if that also becomes too easy, you can also do a little staggered stance where you're going to put one foot back and you try to put most of your body weight on one leg. Still want to have both legs planted on the ground, but the foot in front, make sure that's flat, nice and flat on the ground, and the other one just gonna have your toes on the ground. And again, you could do it with the table. You're gonna stand up and then come back down. And again, you would rinse and repeat this for both of the legs. So you get here, and then you can also do it without a leg, like so. Thank y'all for tuning in and watching. Please feel free to leave a comment. You can also get in touch with us at info@diabetesyoucanwin.org. We're also on Instagram, Facebook, and LinkedIn if you search for Diabetes You Can Win. You can also visit our website at diabetesYouCanWin.org, where we'll have more information regarding diabetes prevention, management, and treatment, with educational materials as well as different activities and community outreach programs that we're currently participating in. You can find links of all of our web pages down below in the video description. And we look forward to hearing from y'all, and y'all stay strong out there.